Hey guys, Dr. Nickels again, and we are going to do another Dr. Nickels 2 cents. Today we are going to talk about the male midlife crisis, which is actually deemed andropause. So this is the manly menopause. So yes, ladies, men do go through their hormonal changes just like us. But we see it as not necessarily hot flashes and night sweats. It is the buying the sports cars and wanting to drive real fast and, wearing different clothes. Although, that could be because of hormonal change. That could be for other reasons as well. So, men and women go through a hormonal change. And, essentially for women, it's the drop down in progesterone, estrogen as well, but mostly progesterone. And men, it's the decline in testosterone. So testosterone, peaks, early 20s, but then it starts to decline early 30s. So ultimately, that's when you start to see the decline. So this can cause fatigue, this can cause low libido, problems putting on lean muscle. It can also contribute to erectile issues. And, men can also have their hot flashes and night sweats and become a little crabby and have some sleep issues. But when testosterone starts to fall, early 30s, as early as, the age of 50, it continues to drop down probably 1%, every year. As testosterone starts to decline, estrogen starts to increase. And so that's where we see our men getting the breast tissue and the belly fat and the enlarged prostate, because the prostate is very estrogen and dihydrotestosterone specific. So essentially, as men go through their manly menopause, they are turning into crabby old women, essentially. And then you have women going through their hormonal change, so you're talking about potentially some big issues. So as testosterone starts to decline, a lot of that is because of adrenal production of DHEA, which is the precursor to testosterone, just because of stress and getting older. A lot of times we see hormonal change and shift in men because of weight gain, insulin resistance. Testosterone levels, when they decline, can also increase risk of insulin resistance, obesity, diabetes, and also cardiovascular disease. So one, if somebody's having these issues, if somebody feels they're going through the manly menopause or the midlife crisis, there are things that definitely can be done. So one, looking at checking hormones, which, checking steroid hormones, the best way to do that is saliva testing. Two, then addressing the hormonal imbalance. It could just be, I don't want to say as easy as losing weight, but you can lower estrogen levels by cutting weight, which in essence would increase the ratio of estrogen to testosterone, and that's like increasing testosterone. Looking at adrenal function, which can also help with this as well. So there's some herbal things that can be done, looking at, maca, supplements like DHEA, like I said, doing things to decrease conversion to estrogen, like a lot of your aromatase and 5-alpha reductase inhibitors, like saw palmetto, stinging nettles, pygeum. So there are definitely ways to balance out hormones, and sometimes even giving testosterone. That is another option as well. So ladies, if you feel your man is going through some changes, there is hope. You don't have to deal with this alone. We can take care of things here at Integrated Family Wellness Center and get your guys in. Let's see if they have low testosterone. All right, till next time, take care.